Hello my viewers, you're welcome to Frank NutriFacts YouTube channel where we discuss only about healthy lifestyles. As we all know, on this channel we talk mainly about nutritional health, eye health, and then once in a while we bring in topics that have to do with our regular lifestyles. So on today's episode we are going to be dwelling more on children's eye health. Now, why I decided to talk about this is because of this issue of parents not wanting to give their children eyeglass when it is actually recommended by a professional. So this is a very dicey topic, and if you're a parent out there or you are related to someone who has a child out there, you are a teacher, then this topic is certainly meant for you. Do not turn your back on this very topic because you are going to go home with something. You are going to go home with one lesson. So if this looks like content you would like to pay attention to, I would like you to grab your seat, subscribe to this channel, and then click on the notification button so that you'll be able to see more of this content, and then you'll be among the first to watch it when I post anything. So without wasting so much of your time, let's get started. Some parents do come to the hospital and then with their children, and they will complain about their children, and some of the complaints ranges from the child not being able to see the blackboard while sitting at the back of the class, or the child not being able to see the board while sitting on the front row, or the child not being able to see while sitting by the side of the class, or you find them telling you that the child always omits words while trying to copy notes, whether from the board or from another book. You see them omitting words. And some of them also complain things like the child does not maintain a straight line while writing. You see them writing from one line to the other, particularly if the person is writing on a note that does not have any line to guide the child to maintain a straight line. And also you also see them complain things like the child not having interest to read at all. Once you bring book, they will just not want to be interested in reading. Or you see them talk things like once you bring book and ask your child to read, they will start sleeping. Or you hear them talk about once their child starts to read, within 10 minutes of active reading, they will start screaming of headache, pains, tearing, and all of that. Or you even hear them talk about things like they cannot, if they want to watch television, they must go very close to the television to watch. Even when you shout at them to go and sit on the chair while watching the television, before you could know it, they're already back to the television and they are almost trying to fall into the television. A lot of complaints are out there that parents bring to us concerning their children. But do you know the funny thing? When they have laid all these complaints and then you try to find out what would be the problem, and then have done all the necessary tests regarding their complaints and all of that, and then you come up with a diagnosis, some of them may require using glasses in order to ameliorate their situations, while some, depending on their conditions, it may just be something an eye drop can take care of, or just an oral tablet. Okay, but some of the parents, when you mention anything that has to do with an eyeglass, they will just tell you,
I don't want my child to use an eyeglass.
Even when you have gone to the extent to explain, this is why I'm doing it, this is what I hope to achieve, there is no side effect, and they'll just tell you, no, in my village we don't wear eyeglass, it's a bad thing to wear eyeglass, and all of that. Some, after you must have encouraged, you can only drag a horse to the water, you cannot force the horse to drink water. So some of them, you will just allow them now to make their decisions. Some will just tell you, I will not allow my child to wear glass, and they leave. Some will tell you, okay, let me think about it. While some also will heed your instructions and then go ahead and do whatever you've asked them to do. Now, I just want you to know that if you fall in the category of those that don't want their children to wear glass, even when it is obvious that they have a problem, or you notice that their vision is deteriorating by the day, and you're still insisting that you do not want your child to wear an eyeglass, I want to tell you that your beloved child, you are doing him or her more harm than good. And I also want to let you know that when this child grows up, this same child will ask you, what did you do for me when you saw me having this issue? This same child will tell you, Mom, I could remember, then I could remember I could see well in my primary school days, but by the time I got to secondary, I discovered I could no longer see again. What happened? What did you do? I remember you took me to hospital. What really happened that the problem that I had could not be solved? And by that time, what would you tell your child? Will you tell her it's out of negligence? Will you tell her because of his sheer stubbornness, because of one again belief, as if your child wears glass, something bad will happen, the child will be stereotyped, or there is a stigma attached to a child that wears glasses? I don't really understand what you will be telling your child at that point in time. And that is why I want you to just sit down. Let's discuss this topic to its fullest. And then you will be an ambassador out there telling people, telling parents how important it is to take their children for eye check. I want to let you know that for an eye to see very well, the eye needs to develop. And for an eye to develop very well, the eye also needs to see very well. Now, for a child that is growing up and the child cannot see the required distance, is not able to see certain target at a required distance, is a signal that the child has a problem. And what it means is that the brain is also not getting enough signal to enable the eye to develop very well. So giving an optical correction, that is, if optical correction is what is required or the only solution for the child to regain his or her vision or to improve her vision, giving it will help improve the eye. Because what it means is that as you give that optical correction, the child puts it on and is able to see better than he or she has been seeing. And then as he's able to see well, the brain now begins to recognize more things and then help the eye to develop and also help the brain to develop as well. If you refuse to allow your child to wear that very glass that has been recommended for him or her, now what is going to happen is that as the eye is growing, the brain's kind of condition itself that okay, this is the limit to which this very child can see, so there is nothing that can be done to improve the child's vision. Let's say, for instance, a child that was seeing at a distance that is not really normal for that age, okay, and there was nothing done like giving an optical correction to improve that could affect the child, because the brain, having stayed for a longer time and did not receive any form of improvement in the vision, the brain now conditions itself like, okay, for this very child, this is the limit to which he or she can see, and there is nothing that can be done about it. So the brain grows that way and the eye becomes stunted, as in cannot improve its vision further. So it can, if you stay more than necessary and there is no optical correction, the eye now takes it that way. So even when you have finally realized and decide to bring your child for examination, even after we have tested and have been able to come up with a particular optical correction that the child requires, you find out that when you put it on, the child will not have any improvement, and that is what we call amblyopia, meaning disease of the eye. The eye is no longer the eye is no longer getting any form of sensitization. The eye has already become dormant. The eye is now lazy. It cannot make any effort on its own because the brain had already conditioned it that way. This is how this child's eye is. There is nothing can be done. And at that point in time, most of the patients are now willing to tell you which one do you want. Now, if it were at that early point in time, maybe the child would have used something as little as very tiny lens, like plus 050. Now you didn't do anything, and by the time you finally decide to bring the child will not be wearing thick power that will be looking like as thick as Coca-Cola bottle. You see? So that's what we are trying to explain. I just want to see if there's a way I can illustrate it further so you will understand it very well. Okay, so this is just to further illustrate what I said earlier. Let's say, for instance, at the point in time when a child was noticed to have issue with vision, maybe the child was seeing 618, when the child was tested, probably this is the limit the child could see. The child could not see all these ones, and then probably refraction was carried out, and with the help of optical correction, maybe the child was able to see up to this extent. And then because of carelessness and foolishness, maybe the parents decided, no, I don't want my child to wear glass, and you're seeing that there is a whole lot of improvement from here to here, and you say you don't want to. Now the child goes home with this very vision and then continues seeing at this extent. A time will come where the brain will now kind of condition itself that this is the limit to which the child can see. And do you know one funny thing? Depending on the type of eye problem it is, this very vision can begin to retrogress. It can begin to reduce. You now find out that maybe if you finally bring the child again, the child may not be seen up to this that it first came with, that he or she first came with. You now find out that maybe the child is not seen only here. There's only 3 lines, 1, 2, 3, instead of 1, 2, 3, 4 that the child came with. You see what is happening. And in other cases, you find out that maybe if eventually you now want to give the child glass, because you are bringing the child very late, when you give that same prescription, instead of the child coming down to up to this extent where the improvement was at that very first time you brought her, because the eye is now struggling to see, because it's not used to seeing only up to this extent, maybe with correction now the child may only see only 1 line improvement or 2 lines improvement at most. Teaching is not easy, so you see what has happened. So that's why we try to beg parents. I'm making this video to talk to parents out there. Please, if you notice your child is having issue with vision, you notice your child is not seeing well, please do not neglect it. Bring the child to an eye clinic. Let the child be examined. Let the child, do you know, in the course of examining it, you may even notice more problems like maybe cataract, glaucoma, and other things. You see, so some people, what they just want to hear is give them an eye drop or oral drug to go home with. They don't want to wear an eyeglass. Please, if your child's condition requires an optical correction for your child's vision to improve, please give it to that child. Let's take for instance, I'm a mom of 3 and my 3 kids wear glasses. As a matter of fact, my first child started wearing glasses at the age of 1 year and 7 months, and she is 9 years old at the moment, and she has been wearing glasses since then. So if I can give my child glass, and I'm talking to you, you should give your child glass. I haven't seen my child. Sometimes I go to the extent of showing patients my glass just to convince them that they should please give their child glass. See some children, you notice that they are having all these what we call strabismus. We call it strabismus. Some people call it 4 o'clock eyes and all of that. You notice that your child has that, and then they are telling you the only solution is either surgical means or through the use of eyeglass. You said no.
Is there no eye drop that will return the eye to its normal position?
Does it make sense? Or you now ask me,
is there any drug that you will take after taking it, the eye will not straighten and become parallel?
It doesn't work that way. So if the condition of your child's eye requires an optical correction, please oblige, wear it. I woke up in the morning those days, I discovered my baby was having squint. In fact, was having what we call esotropia. And I thought it was a joke. And then I begin to monitor it. I said, no. God forbid. I cannot be an optometrist and my child is having squint. So what do I have to tell people out there? What is it that I'm practicing if I cannot do something about it? And I brought the child immediately. At that point in time, my daughter could barely talk. Of course, 1 year and 7 months, you know what it means. I had to do the objective examination professionally, was able to get at the particular prescription I feel she'll be comfortable with, and I started giving it to the child. And luckily for me, my baby likes wearing glass. Okay, so the daddy wears glass as well, so she started wearing it, and that was the savior I had. Maybe if I had neglected the child, if I had neglected my baby, maybe by now my baby's eye would be, one would be at one end and the other one would be at one end, and of course the child's esteem will be affected. That's one thing we don't know. We shouldn't be just selfish. Maybe some are even thinking about money at the detriment of their child's vision and destiny. And you forget that a child that doesn't see well loses self-esteem. A child that cannot perform as good as her colleagues or counterpart has this feeling that I am not up to, I'm not like every other child. Why will you allow your child to go through such an emotional torture just because you don't want your child to wear an eyeglass? So this is all I have to say concerning this very topic. So in a nutshell, if your child has a complaint regarding his or her eye, please do not hesitate. Bring the child. If we check the child and there is no problem, we will tell you your child does not have any problem and we'll ask you to go. But if we come up with something, please oblige, listen to what we have to say and do exactly what we have asked you to do. Then some people too also manage to get the glasses, as the case may be, but they never monitor their children to know whether they are wearing their glass or not. As a parent who loves their children, if an optical correction is given to you, is given to your child, the first thing you do is, irrespective of the child's age, try to talk to the baby. You are going to be wearing glass from now on. Insist that the child wears it, whether the child likes it or not, whether the child is comfortable or not. Insist. There's something we call adaptation time. As you keep on insisting and the child is wearing it, as time goes on, the child has no other option than to start wearing it. That's how it works. Secondly, talk to the school health teacher and the actual class teacher of your child. Tell them, from now on, my child will be wearing this glass, and also make them to understand that this is a medicated lens. That's the language you understand. This is a medicated lens given by a doctor, so ensure my child wears it. Do you know some children obey their teachers more than their parents? I have seen situations whereby children wear their glasses as recommended or required in the class, but as soon as they come home, they will remove their glass and they will never wear it, only to remember it the next morning when they are on their way to school again. So as a parent, ensure that your child wears his or her glass both at school and at home for you to get maximum benefit of whatever that correction has to offer. So I would like you to please ask me more questions and all of that. I am ready and willing to reply to as many comments that I'll be seeing right now. So until next time, bye bye.